Going into my freshman year of college, while playing a soccer game, I would end up tearing my ACL simply by planting my foot and turning my whole body around. Many of you today in the audience play low-impact sports and have heard of friends, family members, or even teammates that have torn their ACL. Many of you at home may have had the same experience or have heard of high-profile athletes of tearing their ACLs as well. But what exactly does it mean to tear your ACL? Whenever I injured mine, I knew that something was wrong with my knee, but had no idea what tearing of the ACL meant. My name is Christina Koremis, and today I'll be talking to you about ACL tears for my informative speech. For a preview of the speech, I will first be talking to you about the anatomical position, tearing of the ACL, identification of the torn ACL, treatment of the ACL, and recovery from a torn ACL. First off, it's really important that we understand the anatomical position when understanding where the ACL is. So, whenever looking at anatomical position, it's important to remember that our hands are at our side, our feet are slightly staggered, the anterior side of the body is in the front, posterior is in the back, medial is down the middle, and lateral is at the sides. Now that we know these anatomical positions, we can apply it to the knee. So obviously, when looking at the ACL, it stands for anterior cruciate ligament, which is obviously the anterior side of the body, behind the patella, which is kneecap. When thinking of PCL, it stands for posterior cruciate ligament, going to the lateral sides of the body. Lateral collateral ligament stands for the LCL, going towards the middle is the medial collateral ligament. So now that we have located where the ACL is, which is just directly behind the patella, the kneecap, we now can understand that tearing of the ACL is just tearing in half of it. How can we tear our ACL? There's actually many different ways that we could tear the ACL. One is cutting. One, which was my position, was planting of the foot and turning. Another is stopping quick. Another, jumping and landing wrong, which is in the case of basketball a lot of times. And last is collision, which happens a lot in football. So we think that maybe we tore our ACL, but how do we identify that correctly? Without a medical diagnosis, usually there can be a loud pop, which happened in my case. Another could be a severe feeling of loss of motion. Another is loss of extension and flexion, which is just simply bending and straightening of the knee. Another is swelling and severe pain, and loss to perform normal tasks that we perform. So we think that we have these symptoms. What happens next? We decide to do a medical diagnosis. So whenever we do contact a doctor, they decide to perform a physical examination. In that terms, it basically means they're going to be twerking and bending the knee in various ways of motion that we would have. If you fail to pass these motions, then more than likely your ACL is torn. Lastly, if you do think that you failed that test, they will probably project that you need an MRI to see deeply if you did tear it or not. How do we treat the ACL is the biggest question. Many people do not know actually that there's different grades to ACL tears. The highest being grade 3, which is many people think that it's tear of the ACL. However, there's less severe symptoms to a torn ACL. One being a grade 1, which is just simply a strain, maybe a couple tears in the ACL, but not much. Second is grade 2, which is a partially torn ACL, and of course grade 3 being the most severe. In the cases of a grade 1 and grade 2, mostly if you have a very chill lifestyle, you aren't young, you aren't playing sports, or don't have a severe job, a doctor is simply going to say, perform RICE. RICE stands for rest, ice, compression, and elevation of the knee. It won't take long to recover, especially if you have a low lifestyle. They also can prescribe rehab if you do have a higher lifestyle. And lastly, with a grade 3, the most severe, if you are young, have an active lifestyle, or maybe even have a family and are active, they're going to require that you have surgery. This surgery is very invasive, and replacing an ACL can happen in 3 different ways. There could be the use of patellar, which is just cutting at the patellar in front. There could be use of the hamstring, just cutting of the hamstring as a graft. And lastly, a cadaver, one of the deceased and just taking it simply out of them. How does this exactly happen? How is it repaired? Well, as stated before, they simply cut a graft about this big. It's shown on the slide. They cut holes at the ends of it, pull strings between them. If it is a patellar, there will be a scar in the middle, as seen on me and as seen on the slides. They'll cut it out, put it together, and cut 2 other holes to feed it through, and put 2 screws on the tibia and on top of the femur to screw in, and it'll locate a brand new ACL. What's the recovery for a torn ACL? Many of you have heard about the strange and unusual case of Adrian Peterson. He tore his ACL completely, and all of us were shocked that he recovered in just simply 3 months, and next year would become the MVP of the NFL. That is a very, very unusual and rare case, and more doctors are working towards having cases like that to be a norm. However, in low grades, it's obviously a quick return back to your lifestyle. Grade 3 is the most severe. If you're lucky to get back in 6 months, it's absolutely incredible. But usually it takes up to a year's time of intense rehab and work. As a review, I've talked to you about ACL tears today. I hope that you've learned from them the different types that there can be. I hope that you realize that ACL tears are a tough part and something hard to recover from. I hope that you learn to walk in somebody's shoes as I have and learn that this is a very difficult process. Thank you for listening today. Okay, is that okay?